whatever type of medicine we practice, we are doctors, and we should be treating patients according to a diagnosis that we've arrived at based on our history, our physical exam, and the necessary tests. So whatever the problem and whatever the treatment, it does patients a disservice to not really know what you're treating. And it's just part of good medicine and good practice. And the people that graduate from our courses, first and foremost, say, I've become a better doctor now because not only can I practice this procedure that you taught me, but we encourage myofascial palpation, so actually feeling patients with our hands and understanding where is their tension and restriction and pain, so we really get a good feel for what their problems are. And that's not only for musculoskeletal pain, but even for internal problems. We have to reintroduce a hands-on physical exam, because across the board in human medicine and veterinary medicine, there's been this pulling back and not really touching our patients, not getting that information that is right there at our fingertips and is not costly. It's just a matter of putting our hands on the animal, and then that gives us the full amount of options. Once we have a diagnosis, then we can say, here's the conventional approach, here's the integrative approach. But what we do from an acupuncture perspective, though, also differs from a traditional Chinese medicine acupuncture approach, because we're not looking at the tongue and looking for cracks and color changes and feeling the pulse as they do in Chinese medicine, because these diagnostic assessments have never been validated. So while that is hands-on or you're observing a patient, they are relatively meaningless because they haven't been validated for even humans for whom these procedures were designed. And so you're coming up with this metaphorical, what they call pattern differentiation, that is not a diagnosis. So there's the two things. There's practicing better medicine as the doctors we are, scientifically based, etc., but there's also not getting lost in kind of a woo-woo, myth-based approach. So that's what we do, is we navigate between there. So we want integrative medicine, but we want it to be scientific and evidence-based.